Deformational plagiocephaly. What a seriously weird word. It's the medical term for flat or wonky head and means that one part of the skull, usually at the back, is flat and some asymmetry of the whole skull and sometimes facial features are starting to occur. My name's Jolene and I work at Ohana. One of the most common conditions I see with babies is deformational plagiocephaly, and today we're going to talk about what that is and how it can be treated. Interestingly, in the research it shows that the rates are increasing, and it is also now being shown that it's linked to other conditions, most notably developmental delays in motor movements and some cognitive learning issues as well. What causes it? There are two main causes. One is intrauterine constraint, and this is most common with twins or multiple births, and that's basically because they got real squished. Second is birth trauma, and that is more common with forceps and vacuum extraction. Basically what happens for some babies, there is a sprain strain injury of the upper head or neck area during birth, and this is quite sore and tender or painful, and so the baby develops a preference to the other side, the more comfortable side. Which leads me to, how do you know if your baby has one or is developing one? Well, quite simply, they always like to turn their head one way. No matter how many times you come and lift them and turn it back, they're straight back over there. They often like to only feed on one side, and if you look, you can visibly see the flattening and sometimes a bald spot as well are starting to occur. Early detection and treatment is really important. The chiropractors here at Ohana treat this very seriously, and we have done extra training in being able to identify and diagnose the sprain pattern, as well as taking measurements using our special tool. We take measurements so that we can see what degree of plagiocephaly we have and that it's responding to treatment by charting it out. This also helps us rule out a more serious condition called craniosynostosis, but that's for another day. Early treatment is important because in the 0 to 6 month age group, all of the sutural lines of the skull are still really soft and the bone is still cartilaginous, meaning we've got lots of opportunity for normal growth to happen if we take away the strain pattern. 6 to 12 months of age, we can still do some work, but it's not going to be as good a result. As I said, we have been training in more specific correction techniques. These are called cranial techniques, and they're very specific depending on the type of strain pattern that is occurring. The at-home advice is just as important when we're treating our plagiocephaly, so I've got 4 top tips for you today if this is something you've noticed with your little ones. They're kind of really great to do with babies anyway. Our first is baby wearing or baby carrier wearing. This is our go-to. The more you carry your baby, the better. That helps develop their vestibular system, keeps them off laying down, like what happens if they're in a car seat or a pram all the time, and helps them develop their strength of their head and neck. Our second is ball rolling, so using an exercise ball, popping the baby on there and just gently rocking them forwards and backwards and side to side. Once again, like the baby wearing, that helps develop their vestibular system and strengthen their head and neck. Third top tip is lots of tummy time. Pop them down on the ground with things to reach for and play with as often as possible. And our fourth top tip is just for the bottle-fed babies. Often our mums and dads are going to feed with their dominant hand only. So just a reminder to become ambidextrous, start feeding both sides so that baby doesn't have pressure on one side of their head all the time. And it's also great for eye development because they learn to look both ways. So there you have it, 4 top tips and a bit of information about deformational plagiocephaly.